Thank you all for joining me today. My name is Elizabeth Kemna. I'm a continuing care assistant student at the NSCC Annapolis Valley campus here in beautiful Nova Scotia. I would like to present this video to you as my final project for the Dementia Understanding the Journey course. For this project, I would like to share with you some information on how dementias can affect our ability to eat and some techniques we can utilize to assist the person living with dementia. Some of these effects can be forgetfulness, loss of appetite, judgment, distraction, and ability with even the most simple tasks. Some of the ways that we can help with these effects are listed here. Please check with your healthcare provider if you suspect a loved one may be developing signs of dementia. There could be any number of underlying conditions that could be causing the same effects. And once you get those dealt with, the knowledge is power. The more you can help the person that you love, the better. As the disease progresses, people can have difficulty with their senses. So sense of smell, sense of touch, sight, hearing, and taste. Also, when they're eating, they can have difficulties with chewing. This may be teeth problems, maybe it's poor fitting dentures. Those are possibly things that you can help with for sure by going to the doctor and having them looked at, dealing with the underlying issues there. Also, dementia can affect the ability to chew. The brain is not telling the body correct signals any longer. Food goes in, brain starts to do its usual, and then it forgets. It gets distracted, and performing those simple tasks become more difficult. This can also happen with the ability to swallow. Food goes in, chewing might happen, the body forgets how to swallow. If someone is pocketing food and they're not swallowing correctly, this can lead to choking and aspiration, or there might be particles or water getting into the lungs. This can lead to infections. We as healthcare providers, as CCAs, as caregivers, we want to do everything we can to prevent that from happening. So please, when you're assisting someone with dementia in eating, pay attention, stay with them, watch to see if they're swallowing properly, and if they're not, have patience and wait. It's very important that the person eating is doing it in a safe way, and that we as the care providers are there to assist them with that. What you can do to help. Some do's. Present meals clearly. Offer a couple or a few easily distinct different types of foods, not mashed together. Nice scoop of mashed potatoes. Develop a routine for mealtime and snacks. This can give the person living with dementia a sense of routine that they can hold on to. It's easier for them, and it will avoid confusion and distress if they're having meals at the same time. Incorporate nutritionally balanced foods. It can be difficult to get nutrition properly into someone who's having difficulty eating, someone who's difficulty remembering to eat, or maybe they have lack of interest in eating at all. So if you can get foods in there that are high in protein, nutritional supplements, milkshakes, those are all really good. Cues and reminders for mealtime. So when supper time comes along, be patient, allow the person some time to kind of get themselves together and say, supper time, it's going to help you get to the dinner table, get them all settled, give them some encouragement to that. Offer fluids throughout the day. Sometimes people will forget to drink, or maybe they're not feeling thirsty. It's very important that we offer fluids, water, tea, juice, milkshakes, supplements, all very good. It's very, very important we help keep the hydration level up. Mince or puree foods. With someone who's having difficulty chewing, minced foods can help with that. It reduces the exhaustion of chewing, the exhaustion of eating, just give them a little bit of help. Doesn't completely take away from the enjoyment of the food either. For someone who's having swallowing issues, pureeing foods can be a really great way of assisting with the swallowing. For someone who's having difficulty with swallowing their fluids, you can thicken the fluids. So there are thickeners out there you can add that don't give too much extra flavor that would take away from whatever you're putting that into. You can even add that to hot tea, milk, juice, water, whatever it is. Serve smaller portions and more often. It can be a lot to handle when there's a really big plate of food in front of you. That can be exhausting and confusing. So if you give smaller portions that are defined clearly on the plate and offer them more often. Reduce distractions. If you can reduce the noise level, the busyness, what's going on, talking to your coworkers, your family, talking on the phone, having the TV going, this is a lot of sense overload when you're just trying to focus on eating. So keep that in mind. Try to have mealtime be quiet, calm, and enjoyable for the person. Please remember our DIPS principle. Treat the person with dignity. Assist the person to keep their independence. Cater to each individual's preferences. Respect the person's privacy and ensure their safety. Some don'ts. Don't talk through the individual. When you're sitting with them, assisting them with eating, talk with them, talk to them. Don't talk through them to the next person across the hallway or across the room or on the phone when they don't know that you're not talking to them. Walk away when they're eating. This is a choking risk, and it can be dangerous for them if you walk away while they're still in the middle of eating. Maybe you've just given them a large spoonful. Please make sure that you're staying with them and watching that the food has gone down safely. Create more environmental stimuli. If you can keep the mealtime quiet and calm, there's no need to add extra noise level, confusion. If you're yelling across to someone or moving around quickly, try to keep the stimuli down. Force feed. Please be patient. Please have understanding that even just eating can be difficult, and it's so important that people living with dementia are getting proper nutrition. So please have patience with feeding. Do the airplane. This person deserves respect and dignity. They're not a toddler. Please don't do the woo, here it comes. You can offer the food, show and present the food, but don't do the airplane. Don't get distracted. Pay attention to the individual. Give them your attention fully while it's mealtime. Stay with them, have patience, but don't get distracted. Your distraction will probably end up distracting them as well. Here are some techniques that we can use to assist the person in eating. We're going to assume that this person can no longer eat on their own. We want to give them the best chance of having a good meal and have that be safe for them. So when someone's sitting, you want to make sure that they have good body alignment. So right now, he doesn't look very comfortable. He's a little bit slouched, his head's to the side, so we want to sit him up straight. Sit up straight. Nice. We might use pillows for padding at the back. We might use the wheelchair to align a little bit back or forward, depending on which way they're slanted. If they're really far forward or their head's back, we could use a pillow to support to bring forward. We could use the chair to align straight up and down. We also don't want their head to be or their body to be sideways. This is also difficult for swallowing, as the food and fluids will have difficulty going down. So good body alignment. Also make sure that their arms and legs are comfortable. You can always pad the legs. If their elbows are digging, you can pad that as well. Make sure they're comfortable. So now that we have good body alignment, we want to sit ourselves in the almost direct vision of the person sitting. We want to have their full attention. We don't want to be off to the side too much so they don't know where the sound's coming from. We want to be engaged with the person that we're assisting. So sit right with them, get comfortable. You can put your hand on a joint. Will give the person more a connection with you. You're not putting it on soft tissue that's going to jerk them or startle them. So maybe on an elbow, or the wrist, the knee. Also the shoulder is a really good one, so you have connection to the person, and it kind of tricks the brain into paying attention to you and what's going on in front of them. So you've got them here, they can hear you really well, they can see you, they're engaged with what you're doing. When you're assisting with the feeding, make sure you're not giving large amounts at once. So I believe they say about half a teaspoon at a time. If you can do that carefully, you can offer the food. They can see it coming, have a visual of what this is, and it'll cue their brain to open their mouth. And it goes, do what they need to do. If they're having difficulty with chewing, you can rub the cheeks. That gets the brain saying, oh, food. You can also rub the jaw, kind of do this, get the brain putting 2 and 2 together. If they're having difficulty with swallowing, you can assist gently by rubbing your hand downward and giving the tongue a cue of swallowing. Good body alignment, having good attention and connection with the person, giving them your full attention and paying attention to swallowing, assisting with chewing if necessary by those cues, being careful of how you feed and how much you feed, and assisting with swallowing are some good techniques that you can do. Now that we've learned some ways to assist the person living with dementia in getting a good meal, I thought it would be fun to do a little experiment. You can do this at home, and I think it would give everyone a wonderful idea of how it feels to have dementia, even if a little bit. So imagine your senses, as we talked about earlier, are all a little bit depleted, to whatever extent depends on the individual. So your sight is going, right? Try putting on a pair of sunglasses. This will minimize the depth perception. The minimal light you may have in the room could be depleted to a point where you can't quite see what you're looking at, where your fork or your spoon is. Sense of smell and taste. So with sense of smell, you can hold your nose and try to eat something and you see the difference. It's like when you have a cold and foods that would normally be very flavorful seem very dull. It can be like that. Smell, that obviously is both, so smell and taste at the same time. Your sense of touch, so hot and cold can take longer for someone with dementia for their brain to realize, oh wow, that's cold, or that's really hot. So try this. Put on a rubber glove, one hand, get an ice pack, hold it over your wrist. Do that for a few seconds. It's going to take much longer for you to feel that discomfort through the rubber glove. Now try holding it on your skin and see how long it takes you to feel quite uncomfortable. So that difference of feeling between the two. And for your hearing, you could put on a pair of headphones or earplugs and then try to have a conversation and sit with a meal at mealtime with someone and see how that may feel. So a great sensory way to feel how someone living with dementia may be experiencing the world around them. Thank you again for joining me today. I hope you were able to find some information that was useful to you. I would like to thank the following people for all of the information I've been able to learn through this course, all the wonderful techniques I've been able to utilize at work to help my clients. And if you would like any more information on dementia, ways that you can assist, please follow these links. Thank you very much. I make sure. What is funny?
Kirby's trying to get up on you.
First.
I want to be in it.